Welcome to the November 11 MSF Frontline Reports podcast. Doctors Without Borders, Médecins Sans Frontières, or MSF, is an independent medical humanitarian aid organisation. I'm Corinne Baker. This week, we continue our two-part series on the crisis in Somalia, where MSF teams are battling to contain the deadly measles outbreaks ravaging a population that is already enduring a nutritional emergency. The outbreaks have hit camps for internally displaced people, or IDPs, especially hard. Abdinur Jils came with his son to a makeshift camp set up in Rajo, on a beach in the capital, Mogadiscio.
My son is named Noor Abdinur. He is 1 year old. Noor is suffering from measles and he's been coughing badly. He also has stomach problems. He has never been given any vaccinations before. We came from Damai village of Sablali district, Lower Shabelle region. We left Damai because of hunger. We had goats and cattle, but they have all died. When we arrived from Damai, we were told that we can get medical services at Rajo camp, and we were hungry, so we headed to Rajo.
Noor's case is not unusual. Right now, the combination of acute malnutrition and measles is proving to be a deadly threat in the IDP camps and throughout Somalia. Joachim Delville is head of mission for Somalia.
There's also big concerns about the spreading of deadly diseases like measles. So our teams are actively working on vaccinating both IDP and host communities in measles.
Measles is an airborne infection, and the disease sweeps quickly through overcrowded camps where malnutrition levels are high and immunity levels low. Malnourished children under 5 years of age are the most vulnerable. They get caught in a vicious cycle where measles and malnutrition wear down their weakened body's defences. In such a state, additional complications such as pneumonia or diarrhoea can prove fatal. Somalia's legacy of conflict, lack of development, and a collapsed health system means that the level of routine immunisation coverage is extremely low. The World Health Organization puts it at about 30%. It's impossible to know, though, since epidemiological surveillance systems collapsed over the past 2 decades of war in the country. The top priority in Mogadiscio and in other locations would be an all-out vaccination campaign against measles. But in an insecure environment, like Somalia, implementing mass vaccinations is particularly difficult. Mohammed Ahmed Hussein, MSF's medical coordinator, recently returned from Mogadiscio.
Sometimes we are planning to move out to the IDP camps to do measles campaign or to do a mobile nutrition service. But at one point, there is a security incident here and there which prevent us from going to the camp, or even to reach areas which there is urgent need for medical attention, but because of security you cannot reach.
In mid-October, MSF was forced to suspend a vaccination campaign in Dainil, on the outskirts of Mogadiscio, after heavy fighting erupted between the forces of the Transitional Federal Government, supported by African Union troops, and the rebel group Al-Shabaab. The campaign was supposed to have lasted 3 weeks and reached 35,000 children, but was cut short after just 5 days. Only 4,800 children were vaccinated. The team also treated 83 war wounded during the outbreak of fighting. Despite the difficulties, MSF managed to vaccinate more than 60,000 children against measles throughout the country between August and October, mostly through outreach activities and small-scale immunisations. Duncan McLean, MSF's program manager for Somalia, says this number, while good for those who are actually vaccinated, falls far short of what's needed.
But it's not enough. At least 10 times more need to be vaccinated to ensure broader coverage and to have a larger impact on the epidemic.
If you would like to learn more about MSF's work assisting Somalis, please visit somali.msf.org. MSF is an independent medical humanitarian aid organisation that delivers emergency assistance to people affected by wars, epidemics and natural or man-made disasters in more than 60 countries around the world.